Welcome back, everybody. Excited about today's episode because I actually have a very special guest with me here today. We were just joking, the first solo guest on the show. And so excited to have Dr. Larry Black join me today. And we're really going to dive into like how do the strategies and the things that we talk about actually play out in the office, right? So talk a little bit about his story, what's going on with his team, their experiences. And so hopefully you can, as you're listening to this, kind of pull and think like, well, hey, maybe that's something like how my team would respond, or looking for, well, what's the doctor's perspective of this? So Dr. Black, thank you so much for joining.
Hey, Flint, great. Thank you. Pleasure to be here.
Awesome. Well, hey, just to get us started, let everybody know who you are. Tell us about your practice, a little bit about your backstory. Yeah.
Sure, happy to. Dr. Larry Black, been a dentist for 21 years now. Born and raised here in South Georgia. I've got a practice in Valdosta. This is actually my third practice that I've been in. Actually bought a small practice when I graduated dental school, 4 operatories, 1 front desk person, 1 assistant, 1 hygienist. We worked there for about 5 years, grew out of that, built a brand new office in a better location. We spent about 6 years growing that. Brought my wife into the team. Wasn't sure if that was going to be my best decision ever, but it wound up being amazing. She had a real eye for crossing the T and dotting the I's. We lost that office to a fire in 2018, and luckily we were able to roll right into this office, and we've been here ever since. Just a general dentist. At this point, we have 2 full-time hygienists, 2 full-time assistants, and 2 front team members. That's when I began PGI, Practice Growth Institute, Scheduling Institute. Initially started out with the plan of I wanted to implement some policies and systems. Got to sit down and do a planning day. Had a really great experience. The team member was pointing out some stuff that I had taken for granted. The growth that I had, that I really hadn't thought about, just kind of factored in day by day. Pointed out some things that she thought y'all would be able to help me with. I was really excited about it and agreed to start using the coaching methods. And it's been a great thing ever since. Great relationship to have.
Awesome. And yeah, so I know, I think you originally started with us in like 2021-ish, I think would have probably been that time, right?
Correct, yeah.
So 2021, and it's funny, we are on the New Patients Now podcast. So to give people kind of an idea of, where you guys were then, it's kind of cool. Like I love to look back and kind of see where people were when they first started, right? So you're in the same office as you were in 2021, right? And from what I could find, it looks like you guys were doing like 18 or so new patients a month when you first came in. And in August, you guys saw 76. That's pretty cool.
Right. And the amazing thing was, if you would have been a fly on the wall when that was going on, my team was completely convinced that that's impossible. We can't see more than 20 patients a month.
Yeah.
We're everything that we can. There's no way these guys are leading you down the wrong path, thinking that we could ever do more than that.
Yeah.
It was really been fun and eye-opening for me as well as my team to see how the opportunities were there that we just didn't realize, that we didn't turn people away because we were full or thought we just didn't need anything else. We just didn't see that the opportunity was there.
Yeah, that's so awesome. Because, yeah, and so you had the same number of team members back then? So it was 2, 2, and 2?
Yep.
Same number of teams, same practice, right? So it's like, take me back, because we've done a couple episodes on, okay, how do you actually like approach that idea of training the people in the office, right? So like you're kind of describing, hey, we had these, really like kind of like self-limiting beliefs that you and the team kind of shared. What was that first time a trainer came into the office? Like, what was that like? Do you remember that day?
Oh, I do. It's like it was yesterday. It was so good, because my wife was the planner and the real driving behind the policies and the system.
Mm-hmm.
She had done a really good job with the office and moved it so much better than I had, because I just enjoy doing the dentistry. I enjoy spending time with patients, and as long as I've got patients and I'm working every day, I'm busy. In my mind, I'm doing what I'm supposed to be doing.
Right.
She saw that we could do it better and smoother and better experience for the patient, just because she was working in the front office and I was just face to patient. When SI came in, they reinforced that. The thing that I really loved about the Scheduling Institute and what they represented was all the offices that they'd been into in so many places over the country, because I was a typical dentist. This isn't going to work in my house. This isn't going to work in my small town. You guys don't understand how it is here. And once I started talking and realized that there was case after case after case where that wasn't the way that things really worked, I started opening up a lot more to it, and embracing some of the philosophies, and trying to just empower my team to be able to do more. In the period that we first started out with Scheduling Institute, I had my office manager had decided to take a different job. I think she just didn't really think that SI was going to be a good fit, and she just didn't want to be involved with it. So I'm really lucky in that having that turnover. I got the office manager that I've got now, who had been Scheduling Institute trained before and had seen it work in the office that she worked in. So to have that, and her be able to talk to the other team members and reinforce what I was being told and what I was trying to implement, that in my mind was probably one of the biggest things in being able to expedite things the way that we did. Seen a lot of practices who were able to grow and develop like that, and took them a couple of years to do that. So the fact that we were able to go from 18 to 20 patients to 60 or 70 patients routinely a month was probably mostly in part of that.
That kind of like that you being engaged in it, the team being engaged, like everybody kind of same direction. Is that what you're what you're describing?
The old analogy of just getting everybody rowing in the same direction.
Yeah, absolutely.
Really made a difference for us. The team trainers were wonderful in that they come in and they're on our side. If you have a team member who just doesn't see it, they don't think it's possible or don't understand why we want to change things, the trainer was so beneficial in that they were impartial source of information for the team member. All of a sudden, it's not the doctor just wants me to work harder and he thinks I don't do anything. They were able to explain to them in a positive manner and really give them to understand why it's important, how it's going to impact the whole office, how it's a better experience for the patient.
Yeah. Like, how important do you, because I think that piece gets overlooked sometimes, right? Like, and last time I saw you, we were talking a little football, and so it's, you think about, like, when you were a kid, or if you have kids, and you try and coach your own kid. Like, I remember my dad tried to coach me in football at one point, right? Or in a number of sports, and for some reason, not that he was wrong, but I was just always going to listen to somebody else more. You know what I mean? Like, is that how you were, or is that just a me problem?
I think it's a universal truth. Whether it be team members or children, there's something about having somebody come in and sometimes just stepping away from the routine day to day, and having them see that it's not just me who thinks we can do this. This is somebody who doesn't know you, who doesn't know us, doesn't know our office, but they've got a proven track record and can show you examples and have a program set up that works, and it works in multiple places in multiple situations.
Yeah, no, and going into that first training, right? Because obviously at this point you guys have done a bunch of on-site trainings, and so it's probably more the norm than what it was then, right? Like, was that the first time you had done anything like that with the team?
No, I'd actually done one or two others.
Okay.
And it's so funny because it's just, so many things ring true. I was the typical doctor who, we're going to do this, and they kind of looked at me and said, okay, yeah, let's go for it. Give him 2 months and we'll be doing that. And it had happened before, so they already knew.
So they were going into that training like, okay, let's just get through the day. He'll get over it, right? Is it like kind of that kind of thing?
Exactly, sure.
Oh, gosh. How often do you think that's happening, right? Like whether it's doctors going out to seminars or CE courses and they're coming back all fired up, like, and just have trained the team to almost just be ready for that.
Sure. I think it just, like it was pointed out to me, it's a day in, day out thing. We doctors tend to go to a course and we go by ourselves. And we come back and we're trying to explain things to the team the same way that it was explained to us, knowing deep down that we're not polished at doing it. We don't have good examples of it. You're trying to explain to them, and they showed me this, and they showed me this, and you're jumping around so much. There's no cohesive message there. Having the Schedule Institute trainers come in, and there's a flow to the message, there's a rhythm to the process, and they can put out the message, reinforce it, show examples. You start to watch the team as they nod and as they start to get the picture, the light bulb comes on, and they understand how it can be done, not just, he wants to try something new and this is going to be terrible and no follow through. So the biggest benefit of having a trainer with that follow through, with the check-ins and stuff like that, encouraging the team and encouraging the doctor to follow that through is so key.
No, absolutely. So, and I guess, what you're describing is kind of that accountability component, right? So we came in there for the first time and it was probably, right, we're ready to say yes and nod to this while the trainer's here, but then, oh, wait, now they're actually going to hold us accountable every month. So like, what was it like if you look back, right? Because obviously it's kind of now a part of your process, but like that first introduction of, hey, we're going to train, but also you're going to get graded on this every month. Like, how did the team handle that the first time it got presented?
The first step we did with like a lot of offices, we started with the 5-star telephone system, completely foreign. And I pretty much had the same reaction that I'm sure a lot of the doctors that you guys get to work with had when they send you to that recording of your beloved front desk employee speaking with the person who just wants to come into your office and get taken care of. And it's nothing like what you've ever heard them talk to anybody on the phone. And you're starting to shrink as you realize that's really her, and that's really the way the phone's being answered every day. So we had the trainer come in. We started talking about the 5-star telephone system and the some of the scripts of the telephone call and the explanation that this is the message we want to get across. This is the reason we want you to use this verbiage. This is how this works. Doing the role playing. And even for me, realizing as I sit there and listen to the trainer with the team and understanding the message that I was supposed to get across, understanding the rationale behind the way that the verbiage is put together, and then trying it role playing and realizing how hard it was, how I messed it up over and over and over again. I think that let the team see that, you know, nobody's perfect. We're going to make progress. We're going to keep going with it. And then when we started going over the 5-star telephone phone calls later on that they get from the trainers, and it was kind of like, okay, he's really not letting this go.
Yeah.
This is again. It really started bringing home the point that, all right, this is going to be every day. This is the way we're going to do it from now on.
Yeah.
And then laying down that expectation for our team that we're going to train on this until you get it right. It's not an option anymore. And this is why it's important. And that's, I think, helped them a lot to understand why we strive to do that so hard.
Yeah. No, I think that's so important for people to hear, just the importance of repetition, number one, and then how important that accountability component can be, right? Because it's like we can train, but if, you know, the reality is if anyone, it has nothing to do with if they're a team member in your office or not. If I know nobody's ever going to check on it, right, my level of engagement is probably not going to be as high. So I guess, okay, so you got the recording, you're like, oh my gosh, I could have sworn that something else was happening, right? You like that moment of, I don't even want to believe this, but right, you were willing to kind of like accept that and lean into it, right? And so now, I guess 4 years later, right, you started 18 new patients a month. Your last few months, you're probably averaging closer to 70. A lot of people in hearing that, right, and hearing that you have the same number of team members and you have the same office, right? I have to imagine, just because I do hear it enough, that there's probably an assumption that the patient experience has suffered, right? Like there's probably, like you, probably yourself in 2021 would probably look at this and say, there's no way they're giving good service to the 76 like they were with the 18. So how has that changed over that time?
You're exactly right. I would have told you the same thing. Our patient experience is actually elevated just because of the team aspect and the repetition. Doing the 5-star telephone system. Then now that we have a system for greeting the patient, now that we do the office tour, you can see patients when we give them the office tour, they're walking around completely, it's something new to them. Just the look in their eye, they some of them are kind of funny. They don't almost know how to take it.
Yeah.
It's just something they've never had done before. And we get so many patients, the welcome gift and just you see them, that their eyes light up, just the fact that they're getting something when they go in for a dental exam or just to get checked on something that's bothering them. They've never had that before.
Yeah.
We look at our reviews that we're getting from patients are just going up and up and up, and what a positive experience it was, and what a great, it was so good talking to this team member or that team member and tell them I said, hey, and I can't wait to see them next time. stuff that I just never heard before.
Yeah, that's awesome.
It really has changed how we do everything.
Man, yeah, it's funny, that just that piece of you're telling me okay, so that's the experience component, right? Now, like, because I'm trying to position myself as the skeptical person who's listening to this, and it's like, well, where can I find the problem here, right? So, okay, so we're doing almost 50 more or 60 more new patients a month. The experience is better, but how are you able to see all those patients with the same number of people? Are you telling me that we found out that you can move faster?
We the it always kind of comes back to me, my time in the military. The thing that I learned through repetition, through practice.
Yeah.
They tell you slow is smooth and smooth is fast. So you're not trying to move faster. Your process moves smoother.
Yeah.
Without the bumps in the road, without the misfires, the when the ball gets dropped less, it's always just a smoother transition. We're still working on our getting our handoffs dialed in the way we want. It's a constant process with making that part smoother. The less times we have to go over something is always beneficial. So we're still plenty of room for improvement, and I think that's going to get better and better as we go. The our scheduling, we realize that having our rocks in the schedule anchors the procedures that we've got, and once we have that opens up more time that we just weren't being productive. We had the time there. We were in the office. We haven't added any days to the schedule or anything like that. But just having the understanding from the front desk what our time allotments look like in the back, having a clear message with where they can put things and where they can't. Now they're able to more confidently put a limited in or to have a new patient come in and just have that transition go smoother.
Yeah. No, that's awesome. Right. And I think I just feel like those are some of the biggest misconceptions, right? It's like, well, we can't do more, right? We feel capped out, right? And obviously you're certainly a testament to kind of the before and after of just looking at things differently, right? Like how important, not only for you, but for your team members and maybe somebody who's listening to this and saying like, man, maybe it'd be nice to be able to do that, or I don't know if I can do that. Like, what would you say to the doctor who is probably more in the camp of where you were 4 or 5 years ago, like in encouraging them of just like, well, what can I really do?
Sure. And I think dentistry's well versed in how much better we can be with everything we do when we train more, be it more CE. Nobody my age anyway does a root canal the same way we did 15, 20 years ago. We don't do any kind of orthodontics the same way we did 15, 20 years ago. It's gotten better. It's gotten faster. And just seeing how, as we get coached, be it through continuing education, be it through Scheduling Institute, you're going to have new ideas incorporated. There's going to be new methods to do stuff that is ultimately better for us and for the patient. Mm-hmm. So as long as you've got an open mind to improvement, change is not always a bad thing. We tend to be really good technicians a lot of times with our hands. We like interacting with people, but we don't typically do a really good job as numbers people. A lot of dentists I know struggle from the running the business side of doing dentistry. And the sooner we can, or the more open we are to taking advice from someone who does that well, the more beneficial it is to us.
Yeah. Do you think most doctors find it harder to be accepting of that than they are in the clinical area?
I think so. My experience was this is my office, and these are the people that I grew up around, and I know them better than anybody else. And when somebody tells me, "Oh, this will work in your office," I would always go. That was my go-to. Well, that's in other places. That's not here.
Yeah.
100%.
Maybe over there, just not here, right?
Sure.
Yeah. Nobody else has ever said that, right?
I've heard it once or twice, right?
Yeah. No, I think it's important, right? Because there's somebody else listening to this, and maybe that's kind of how they've been thinking. And I think it's important to know that it's why it's principles, right? Now, you said a number of times as we've been talking, right? Like better for the patient, making the patient experience better, improving what's happening. So and I think for the person who's skeptical or thinking about how much more confident are you, or are you more confident today that your office is the best place to go in town than you were 5 years ago?
I'm actually doing something that the old saying, "Put your money where your mouth is." The office we're currently in has 6 operatories, and I've got the team that I've had for years and years. We are in the planning phase. We purchased the building. We're getting ready to increase our space a little bit more than 2 times. So we're getting ready. When we initially open our new office, we're going to have 12 ops with the potential to go to 16 ops.
That's awesome.
And yeah, we're going to increase our human capital and our capacity to be able to treat more patients and take care of more people, because we've got a demand for more space than what we've got and more time than what we've got. So we're going to build a new building that's going to help us help those people. And 5 years ago, my goal as a dentist was to start to pare down the patients that I didn't enjoy treating. I was just going to kind of fade off into the sunset. I've had a great career, loved it, but it was more because I didn't think I could do anything more than what I'd already done. So I was just kind of ready to ride it out to retirement.
Wow.
And you guys have helped me turn that around completely.
That's awesome. That's cool. Okay. So like a total shift. That is
Sure.
cool. Man. Okay, so for those of you who are listening and you're asking, well, he didn't directly answer that question. Let me just go back. I asked, does he have confidence that he has a place that is gonna serve the patients great and give them an awesome experience? And the response was yes, to the degree that I'm doubling my ability to do it, right? Which is so great. I love that. Okay, so I think we won't go too much longer here, but if you've been doing this how long? Like how long have you been practicing, right?
21 years, yeah.
21 years. So you are kind of in the stage of life of probably more willing to be accepting of, hey, I did this well, I did this not as well as I would have liked maybe in the past, because you have the benefit of reflection, right? But is there anything that you would offer as advice to a younger doctor who maybe is right out of school, considering practice ownership, or maybe is in their first couple of years, that maybe you looking back, you're like, man, I wish I had done this differently?
100%. When I first got out of school, I was so tired of training, and I'm so tired of telling people how me what to do. And all I wanted to do was get out there and start treating patients. I wanted to help the patients. I wanted to make enough money to pay off my student loans. Um, if I could have gone back and changed anything, I would continue getting coaching. The most dentists that I know agree that when we get out of school, we're perfectly capable of treating patients. We can cut teeth, we can pull teeth, all the great things with that. But a common theme that I hear is we didn't get enough business training. The schools are doing better with that now. I think they heard that we were inadequately ready to run a small business. But when, with like me, I didn't go and work as an associate anytime. So I literally got out of school and started running an office. And if I could have had more instruction on what was possible with doing that, that would have enabled me to run a better business for the past 21 years. I could have seen more patients. I could have treated more patients. I just didn't know what I didn't know. And I was doing the best I could with what I had. And we did fine. We made payroll. We grew. We served a lot of patients. But I didn't know how inefficient I was. And that would have been really nice if I could have improved that earlier.
Yeah. No, I think that's important. So for the young doctor out there, right? Those creeping thoughts of like, wait a minute, do I not have this totally figured out? Now, do you think that most young doctors fresh out of school look at it that way, or do you think it's maybe a little bit different, right? Like, have you been dealing with any potential associates?
I hired my first associate 2 days ago.
Oh, there you go.
So I'm turning the page on another chapter. We're gonna start learning all over again with that. Super young lady. She's got a world of potential. I think she's somebody who accepts coaching well. So
That's great.
we're gonna be able to grow her. I really think from most of the newer graduates that I've seen, they are still a lot like the older graduates. They're still so overwhelmed with student debt and what's it like in a real dental office. I've done this in school and I've mastered the typodonts and the mannequin. I've got that down. But now I want to learn as much as I can about the craft that I've chose. It's really easy to overlook how much better can I do financially and time management wise because we're so busy helping patients the best way we know how.
Yeah.
But yeah,
Absolutely.
the process of accepting the fact that you need coaching, you need to have someone who's capable of showing you a better way of doing it, because you don't have enough hours in a day to go and research and develop this and reinvent the wheel to do a better job of managing your office and taking care of your employees and helping more patients.
Yeah. So you mentioned you have most of the same team.
We do. Yeah.
Right. So if you, like, what do you think your team would say about, like, what's happened in the last 4 years, right? Like, do they ever, do you guys ever talk about that and just kind of, like, think about, hey,
We do. We've talked about, if we had just maintained what we were doing, where would we be? How would things be different? Part of what I've done is with my team and our growth and development, I'm recommitting to mentor my team, as well as now that I'm developing an associate, I'm at that point in my life where I want to give back. I want to help them. How can I, anything from managing money and managing time that carries over not only in business but at home? How can we develop better time management skills so we get more time to spend with our kids, more times with our spouse, that we got enough money left over to have the new car or to go on the vacation that we want. How are we going to take care of our kids' education needs as they grow? Um, we have to develop the habits of saving money for that, and I want to be in a position where I can help them with that and give them something that will contribute to the rest of their life.
Yeah, that's cool. That's really cool. And to think that that's where your mind is today, with a practice that's significantly busier
Sure.
than it was 5 years ago, and it's like, was that the kind of thing you were thinking about 5 years ago? Of like, how am I gonna, right? So, to for the people out there who think, well, if I just get all serious about growing the practice, like I'm just gonna get obsessed with money and like myself. It's like, well, sure sounds like you're doing something different, which is awesome to hear.
My goal 5 years ago was to draw my practice down, get rid of all the insurance that I could, and just kind of do the cases that I want.
Yeah.
Now we're looking at growing without taking on that much more insurance. We may or may not start to accept going network with one more insurance when we initially move into the new building, just to help get the flow. But for what we're seeing with the new patients, I really don't think we're going to need it. And we'll still be able to grow and develop and have the new building in a nicer location, a better facility for patients, and have just the team to support all that.
Yeah, that's awesome. Yeah, that consistency, that direction, right? All of you being on the same page. I think that's so important. So I guess to kind of take us home here, right? So you've talked a lot about kind of your journey, the change that you've seen in yourself, right? Obviously, right, the results of the practice, that's great, but I'm hearing a lot of non-statistical changes that are pretty awesome, and I think sometimes get overlooked in this whole process. And obviously, right, your team's going through this process with us. They're getting trained. We're working the 5-star program on the phones to keep that new patient funnel open. All the while, you're obviously being developed as the leader, right? So, and you mentioned at the beginning, but it's the repetition, it's the training with the team, but you're also leaning into that and getting coached and developing yourself as that leader. So I think that's an important thing for people to realize, that to do something like this, to see that big of a shift, you probably can't just, hey, fix my people, I'm fine.
Sure.
Right.
Right.
Did you ever have that thought, or were you always kind of knew, like, I probably need to, lean into this too. I can't just, like, fix them. I'm good. Like,
Definitely. One of the things that I've seen more in the past 2 years, I've probably read more books and more literature on setting boundaries and how to have the tough conversation. It's stuff that I thought I was pretty good at, but I didn't realize where I was struggling or where I was falling short. And once I've started studying again and doing some of the things that I knew I needed to do, it really helped make things easier. Not waiting until something was a problem. Go ahead and have the conversation with somebody. Appropriate ways to do a 15-minute check-in every other week, just to sit down, get a read on the team member, how they're doing. I feel like they really appreciate the fact that instead of doing our morning huddle and then running right to patients, we take a few minutes every once in a while to just sit down and go, how are things with you? What do you need? to do your job? Are the tools that I've got for you everything you need? Is there some training that you're lacking? I can help you get videos for that. Or is there something that you're struggling with? You feel like routinely day to day for patients that I need to do for you to help me take care of our office and our business and our patients.
Yeah.
So
Love that.
that's something I just had never realized that I wasn't very good at, that I've been trying to improve on.
That's awesome. That's cool. Well, hey, I appreciate you jumping on so much. Obviously, please tell your team congratulations again from me for winning the Beat the Baseline contest, and keep up the awesome work with what they're doing, keeping that front end open, right? So you guys can just serve more people, and that'll just serve you guys so well as you transition into having that larger space someday, right? So that's all super exciting. Anything?
No, and thanks to you guys for all you've done to help us grow and develop our practice, and just get the training for my team that we didn't know we needed.
Yeah, awesome. Well, hey, I appreciate you, and I appreciate your team for the work that they're doing as well. Awesome. We'll see you guys.
Appreciate you guys.
Alrighty.
You guys are great people to work with.
Awesome. Well, we will see you next time on New Patients Now.